to give everyone an update on our current situation and talk about kind of where we've been and where we are now. As you know, the first case in Oklahoma was on March 6th, and we, at that time, didn't have a surge plan in place. We did not have any in-state testing capacity or testing supplies. When we looked at the state stockpile, we had 1 day of PPE on hand, and we were really working in crisis mode. We came up with a plan to push out PPE to hospitals when they had only 3 days supply left on hand, and developed a surge plan, and tried to develop those supply chains and beef up our PPE supply, and increase our testing capacity within the state, and really had to work through this whole process. Our original modeling that was done by our state epidemiologist showed that by that first modeling prediction, on July 21st, they were expecting around 30,000 deaths in the state of Oklahoma. At this time, I believe we've had 432 deaths. So you can see that model we certainly helped decrease the number of deaths in the state of Oklahoma and active cases by all the things that we did with social distancing, safer at home, and the temporary closing of non-essential businesses. You can see where we are today, where we've had a total of 432 deaths. There were 4 new fatalities last night and 1,000 new cases. Back in April, we were testing around 1,500 to 2,000 tests a day was our capacity. We had done a combined total number of tests of about 22,000. And then today, we've done over 449,000, about 450,000 tests, and we're usually doing around 8,000 to 9,000 tests a day. So we've greatly increased our in-state testing capacity. Today, the present time, you can see that what's going on in the United States, there's obviously increasing numbers all around the United States, and we're watching that data very closely. Of course, it's very concerning to us, but you can see that we are one of the states that are performing better than the national average as far as percent positivity. We also developed our surge plan, which we still have in place. So that was where we had our healthcare system, had around close to 5,000 beds. We asked everyone to plus up by 40%, and everyone really came together. Then we had the safety net rings out there with the COVID flex sites, and then the potential sites for the Army Corps of Engineers to build those stand-up hospitals. Those are extra additional COVID hospital beds that are basically our insurance policy. So we went from our crisis mode to now we're in a risk management mode. We're assessing the data daily. I'm talking to the hospital association and the hospital CEOs. They're all assuring me that we have capacity still, that we're doing well. Obviously, the numbers are up there. We've had 2 days in a row where we've had about 1,000 positives, and that is always a concern. But what's more concerning are the hospitalizations and the deaths. And we watch the percentage of positives to hospitalizations on a daily basis, and actually that percentage has gone down. The percentage of hospitalizations to positives has actually gone down some over the last few weeks as our numbers are rising, and that's probably because of that large group, that 18 to 35-year-old age group. And I'm really happy to take over any questions when we're done with this, but I just want everybody to kind of see our current situation, where we went from our crisis to risk management mode, and how we're basically assessing, working through this. And right now, the hospitals are really doing a good job. They're wanting to really take the lion's share of this, and as far as the management of this goes, and make sure that they're able to transfer patients when they need to, And we've got the COVID hospital beds waiting for them if they need them. But so far, at least in the metro region, they haven't had to have it engage into that very much. In Tulsa, they had to use them some, but we're still good here in Oklahoma City as far as the total number of those beds.